Next, let's discuss Abruptio Placentae, the premature separation of the placenta from the uterus. Risk factors include hypertension, preeclampsia, abdominal trauma, and the use of cocaine or tobacco. It presents with sudden onset vaginal bleeding, abdominal or back pain, high frequency, low intensity contractions, and a rigid, tender uterus. Diagnosis is primarily clinical, but ultrasound may show a retroplacental hematoma. Complications include fetal hypoxia, preterm birth and mortality, as well as maternal hemorrhage and disseminated intravascular coagulation, or DC. This condition is a medical emergency requiring rapid diagnosis and management to stabilize both the mother and the fetus. Now, let's look at Vasa Previa, where fetal vessels overlie the cervix. This condition is often associated with Placenta Previa, multiple gestations, in vitro fertilization, and a succenturiate placental lobe. Clinically, it presents with painless vaginal bleeding upon rupture of membranes or contractions, along with fetal heart rate abnormalities such as bradycardia or a sinusoidal pattern. The risk of fetal exsanguination and demise is high. Management involves an emergency caesarean delivery to prevent fetal death. Lastly, Placenta Previa occurs when the placenta covers the cervix. Major risk factors include prior placenta previa, prior caesarean delivery, multiple gestation, and advanced maternal age of 35 or older. It typically presents with painless vaginal bleeding after 20 weeks gestation. Diagnosis is made through transabdominal followed by transvaginal sonography. Management includes advising no intercourse or digital cervical examinations, inpatient admission for bleeding episodes, and scheduling a caesarean delivery at 36 to 37 weeks gestation to prevent hemorrhage during labour. Let's close with another real-life case study. A 32-year-old woman, gravida 3 para 2, at 35 weeks gestation, presents with sudden severe abdominal pain and vaginal bleeding. She has a history of 2 previous caesarean sections. On examination, her abdomen is tender and fetal parts are palpable through the abdominal wall. Fetal heart rate monitoring shows bradycardia. She is diagnosed with uterine rupture and undergoes an emergency laparotomy and caesarean delivery. Both the mother and baby are stabilized post-operatively. Another case involves a 27-year-old woman, gravida 2 para 1, at 34 weeks gestation, who presents with painless vaginal bleeding. Ultrasound confirms placenta previa. She is admitted for observation and undergoes a planned caesarean delivery at 37 weeks, resulting in the birth of a healthy baby with minimal maternal blood loss. Today we covered the critical conditions of antepartum bleeding: uterine rupture, abruptio placentae, Vasa Previa, and placenta previa. Understanding these conditions helps in prompt diagnosis and management, ultimately saving lives. Remember to engage with the pre- and post-podcast quizzes and utilize the Anki flashcards to reinforce your learning. Thank you for tuning in to Med Madness. Stay informed, stay prepared. This concludes our episode on antepartum bleeding. For more detailed study and practice, make sure to check out our quizzes and flashcards. Until next time, keep learning and stay passionate about medicine.